two extremely important goals that we're actively trying to consider how to address. So I am a behavioral trial interventionist. So there are a handful of existing behavioral interventions that I think could be adapted well to this space. Because when you're working with patients with migraine, they live in a culture that stigmatizes their disease. So we need to help people with migraine tap into their resilience and improve their self-advocacy skills to navigate the stigma that exists in their lives. And there are a handful of interventions, specifically acceptance and commitment therapy, as well as patient advocacy training, social skills training, some more social interventions that may be able to help do that. So that's one, and we're very, very interested in that space. There is a broader goal, though, which is to move the needle on how people view migraine in society. Right? Hopefully, in a generation, we don't have to live in a society where migraine is so stigmatized. And for my money, for my lab's buck, we're really interested in trying to intervene in two settings: the occupation setting, so workplace, and educational settings, so predominantly schools and universities, because these are the places where migraine interferes the most with your ability to fulfill roles, to fulfill social roles. And I think that that is a space where stigma starts to develop culturally. We have seen the needle move on a lot of chronic illnesses through workplace intervention and educational intervention. But it would be really helpful if more people with migraine felt comfortable using, for example, the American with Disabilities Act or other similar legal protections that are afforded in other countries in the workplace, or accommodations that may be afforded at school for migraine. And many of our patients just don't feel comfortable doing that because of this kind of stigma around migraine. So I would really like to try to work on some social interventions to move the needle on how migraine is viewed, specifically in those spaces.